For decades, preventing sexually transmitted infections has looked the same. But now, an old pill is being used in a way no one expected, and it's already making an impact. It's known as DoxyPep, and it's changing the way we prevent STIs. This is Grindr Presents The Equality Spotlight, a series exploring the stories shaping Grindr for Equality's mission, a world where LGBTQ+ lives are free, equal, and just. Some call it the morning after pill for STIs. DoxyPep, short for doxycycline post-exposure prophylaxis, is a simple antibiotic taken after sex to help prevent certain sexually transmitted infections. DoxyPep acts as a shield when taken within 72 hours after sex, giving antibiotics a head start before any bacteria can meaningfully affect your body. Meet Jen Hecht, co-founder of Building Healthy Online Communities, a partner of Grindr for Equality that works with dating apps to promote sexual health and HIV prevention.
At BHOC, we work really closely with dating apps like Grindr to bring health tools directly to people. And it's not just about awareness, it's also about providing real choices.
Doxycycline is an antibiotic that's been around for almost 70 years, used primarily to treat acne, malaria, pneumonia, and other parasites. But in 2015, researchers tested a simple idea. Could daily doxycycline prevent STIs? The results were striking. STI rates dropped by nearly 2/3. But then came a twist. Later studies confirmed that it didn't need to be daily. Taking it just within 72 hours of sex worked just as well. And that changed everything.
This is what we saw in studies, but then some of our colleagues in San Francisco rolled this out in a pretty substantial way. And what they saw after their first year of rolling it out at a pretty substantial scale was basically that, right? More than 50% reduction in STIs over the course of that year. That is huge.
What we've seen is that DoxyPep can reduce the incidence of chlamydia and syphilis by about 70%. For gonorrhea, it's about 40% or more. That's less, but it's considered quite the effective tool. This is crucial. DoxyPep isn't 100% effective. While it's designed to reduce the risk of bacterial STIs, like chlamydia, gonorrhea, and syphilis, it doesn't protect against viral infections, such as HPV, HIV, or viral hepatitis. That's why condoms remain an essential tool in safeguarding your sexual health. However, DoxyPep isn't reaching everyone who could benefit.
The fact that you need a provider to prescribe it, the fact that many people don't have health insurance or don't have a primary care provider or don't live in a place where they could easily, get this information. That is the number one challenge.
But organizations like BHOC are working to bridge this gap by connecting people to life-saving information through platforms they already use. Through TakeMeHome.org, they're bringing free HIV and STI testing directly to people's doorsteps.
And I will say that from the very beginning, Grindr was like a very early and ardent supporter of this program. And so when we launched in early 2020, Grindr was like, all right, where are you going to be active? Let's send out messages there. And we saw a very, very high level of engagement from folks who got these messages.
But those direct messages were just the start. Grindr later rolled out a free HIV home test button in select regions, boosting access to at-home testing and building on the success of in-app outreach. Expanding on earlier initiatives, Grindr worked with BHOC to create a DoxyPep tag so users can let others know about their DoxyPep use to foster direct conversations about STI prevention. And it's these types of campaigns that could pave the way for LGBTQ+ health and well-being to reach communities everywhere. For DoxyPep to transform global sexual health, we need to overcome access challenges, scale innovative outreach programs, and make prevention tools available to everyone who needs them. DoxyPep is just one step toward a healthier, more equitable future. Discover how Grindr for Equality and BHOC are breaking barriers in sexual health access worldwide.